So good afternoon, everyone. My name is Bill Moore-Kilgannon. I'm the Executive Director of Public Interest Alberta. We're very pleased that you all came out today on Grandparents' Day. Not to be here on a happy occasion, because we think the direction this government is going with respect to how we're caring for our seniors is definitely the wrong way and definitely unfair. And in the theme of a fair, we decided to host a few different activities that you can see, and we hope that people will be able to enjoy some fair activities as we go forward here. We have over there the Pop the Redford Action Plan, the Seniors Plan, so you can pop the balloons there. We've got the pill toss, where you can put a message in a bottle and send a message to Minister Fred Horn and the Premier, and throw it like you mean it, I would suggest, as you go forward. And then a little later on, we're going to have the 12-legged race to the last available bed. So we're gonna head forward on that. Cheryl, our communications person, is also there, ready to take your message and tweet your message directly to the Premier and to the Minister. They're following their Twitter very carefully, so you just write your message and she'll take a picture of you, and that way your message will be delivered right to the Premier and to the Minister as we go forward. So we also have a number of organizations that have come, set up tables, display tables. We have our own information over there. I know we've got CARP and the Health Sciences Association and others handing out literature. So we're moving forward on that. We're also very, very pleased to have two MLAs here. I think there's just two. I see David Egan in the crowd and Darren Billis from the NDP. Where are you guys? There you are. Excellent. Thank you guys for coming out. Am I missing any sitting MLAs? No? Nobody from the Conservative Party here? They did all get invites, that's for sure, as we go forward. So Public Interest Alberta has a seniors task force that has been doing advocacy work for the last 10 years. And that task force has 16 different organizations sitting around the table, and they're the ones hosting this rally today. And the chair of that task force, who's been doing a fabulous job, is none other than Noel Sommerville. Please welcome Noel Sommerville.
Good afternoon all, and welcome. Bill says he doesn't really believe in conspiracy theories, but it really is a little hard to understand why access to this building has suddenly become so difficult, isn't it? We called this event a fair because we wanted to celebrate today, which is Grandparents' Day. And those of us who have had the pleasure of seeing our children raise their own families know that that is a cause for celebration. It's also a cause for a little bit of surprise. Who knew our kids could be such great parents? We call this the unfair because we want to focus on the horrendous cuts which this government has instituted this year and plans to institute in the future. These cuts have been brought about because this government refuses to recognize that it has a revenue problem. Make no mistake, it is a revenue problem, not a spending problem. If they simply got rid of the flat tax, they probably would have no deficit at all. Parkland Institute has pointed out that if Alberta generated tax revenue at even the next lowest province, it would have $11 billion more each year. But the government doesn't want to address its revenue problem because that provides the excuse for the cuts that it wants to make for ideological reasons. Many groups have been adversely affected by these cuts, but seniors are in kind of a unique position here because the cuts to seniors are affecting the most vulnerable of our society. They're affecting people who are cognitively impaired. They're affecting people who are chronically ill. They're affecting people who are so profoundly frail that they can't look after themselves anymore. The details of these cuts are outlined in this pamphlet, and I urge you to pick a few up and share them with your friends. We're talking cuts like the elimination of the seniors drug program. We're talking changes to the Alberta Seniors Benefit. We're also talking about the government's famous first available bed policy within 100 kilometers. About a month after they adopted that policy, they rescinded it. But all of this is total nonsense. They have been shipping seniors away from their homes and their support systems for decades. My own mother in the mid-80s, 1980s, was shipped out to Gibbons because there wasn't a long-term day bed available in Edmonton. What has changed over the years is we have to ship them further and further because the supply of long-term care spaces is more and more inadequate. The lack of long-term care spaces is an item that is in this pamphlet, and I would urge you to look at it. This government got elected on a promise from the mouth of Premier Redford and published on the PC website a commitment to increase the number of long-term care beds in this province by 1,000 a year for the next 5 years. Then, earlier this year, Alberta Health Services announces that it actually plans to cut the number of long-term care beds over the next 5 years by 1,700. The other horrendous cut is this move to privatize the delivery not only of facility care, but of home care to seniors. And you'll hear more about that from other speakers. You know, when you look at these cuts, I have to ask, when did it become acceptable public policy to penalize people because they're ill? Because that's exactly what this government is doing. As Canadians, we are justly proud of our healthcare system that provides medical care on the basis of need, not ability to pay. But if the Redford government has its way, that's going to stop when you turn 65. And I think that's totally shameful. If the Redford government has its way, we'll have more seniors who are unable to afford the prescription drugs they need to stay healthy. We will have more seniors in facilities that are not staffed adequately and do not have a properly trained staff. I would like to conclude by talking about what you can do about this. And I'm borrowing from Larry Boyd here. He has what he calls the AAA solution. Get active, get angry, and get allies. When I say get active, I mean you've got to get to your MLAs, particularly the PC ones, and educate them about seniors' issues. The best way to do that is to form a constituency action team. That's a group of 5 or 6 people who are prepared to go and sit down with their MLA 3 times a year and let them know what the actual situation with seniors is. On the back of this pamphlet, you'll find out how to do that. I don't think I have to explain get angry. By get allies, I mean talk to your kids and their friends. Because it's not only seniors that are being targeted by this policy, it is also the sandwich generation who are being expected to look after kids and parents. You know, this government is creating huge gaps in the care system, and they're expecting our kids to fill in those gaps, and that's totally unfair. There are much better ways of delivering care. On the tables you will find copies of our position paper on home care, which outlines a much better approach to the home care system. Soon we will be announcing a position paper on pharmacare, because there are much better ways of doing it. But I think what is essential is that this government has to be made to understand that unless it is willing to address its revenue problems and find better ways of delivering care to all Albertans, they ain't going to be our government much longer. Thank you.